back to Straight Talk about Health and Wellness. My name is Mary Henderson, and I am your host. All right. Today we have a fantastic guest today. I always tell you on Straight Talk about Health and Wellness, you will always learn something that you can take home. You can share it with your neighbor, share it with your coworker. Okay, it's always a learning experience here on Straight Talk about Health and Wellness. Today, we're going to be discussing the difference between a doula and a midwife. Some of you might have even haven't heard of a doula, all right? And those of you that haven't had children or haven't worked in labor delivery, you probably said a doula. What is a doula? All right, you're going to find out that today. All right, so today we have a wonderful guest. Her name is Morgan Mason. She holds a bachelor degree in public health from the University of Texas. Ooh, I almost didn't get that right. I must need some my mushroom coffee. But it's with the University of Texas. And also, she has a master's degree from the University of Alabama. And that degree is focused on in maternal child health policies and leadership. All right. Oh, we have knowledge in the house today.
Yes,
We
we
have
do.
knowledge in the house. Oh my goodness. And according to she is certified by the Doula of North America. I think I got that wrong, but anyway, she's a
No,
certified doula. She's a certified doula. And we're gonna bring her on. All right. Hi, Morgan. How are you?
Hello, it's nice to see you, Mary. I'm doing great. How are you doing?
Doing fine. And I want to thank you for taking time to come on the Straight Talk About Health and Wellness show.
Of course, glad to be here.
I told the audience a little bit about you, but is there anything that you would like to add?
Sure. So I have been working in mental health, specifically with women and children for like the past 10 years. My specialty is public health, but I've had a really special focus in this population because I do find that in today's society, there's a lot of instances where they're misrepresented, they're mistreated, misdiagnosed, etc. So a lot of my work has been focused on kind of giving a little extra love to this population that can sometimes go without it. So I'm really excited to share with you guys today.
Oh, fantastic. And Morgan, I was reading that according to the American Journal of Public Health, doula support have lowered the rate for preterm births and has improved postpartum care. All right. So what I'd like to ask you, and a lot of people have this question, what is a doula?
Okay, so we're going to take it from the top. I always have to say to anyone who's a new client of mine or is just trying to get a little bit more information about the differences between doulas, nurses, midwives, I always say that doulas are a non-clinical support. So we don't have clinical medical licensure and the ability to act in a clinical way, the way you might expect a nurse or a midwife would. A lot of midwives in my area, at least, are also nurses that work labor and delivery or have some experience with the population, maybe even in the NICU. And they wanted to get more specialized training to be able to provide continuous care through gestation, through labor, and into postpartum. So doulas take a different role. We do a little bit more of the emotional, physical, mental support for families. We bring in all the support. We really highly advocate for education and making sure you're knowledgeable of all the types of interventions, different circumstances that may arise. So you're prepared and we have an idea of what choices you want to prioritize going into it.
Wow, I didn't know that myself with all that you did. I'm gonna take a moment to remind the audience that this show do not take the place of your OB doctor.
Right.
We do not take the place of your PCP or your OB doctor. All right. So if you have any concerns, if you're having a baby, that big bundle of joy, you're expecting that, and
Mhm.
then if you have any questions and concerns, make that telephone call to your OB doctor, OBGYN doctor. All right. Have that conversation.
Yes, yes.
Okay. So, you were saying the things that the doula does. So the midwives that come in and they do what? What do the midwives come in and do?
So, because midwives are usually licensed nurses as well, they can do a little bit more of the primary care, follow-up appointments after you first
Mhm,
find out it. They follow you in conjunction with your OBGYN usually. And in the case that there's anything adverse that's going on, anything unexpected, there are certain things that they can check that maybe are out of scope for a doula, but they have a little bit
mhm.
access than maybe getting in for an appointment for your OBGYN.
What made you want to become a doula? What was that something there, the way
Yeah.
you go in that line of work?
Well, I started out wanting to be an OBGYN, and I realized all those years of school maybe weren't the path for me. So I wanted to figure out the way I could be traveling on the same road, going to the same
Mhm,
destination, maybe in a different lane. So my lane is a little bit more studied. I would say we focus more on the literature, on the research, on the background. And we are able to be a resource and refer to other specialists, whether that be an OBGYN, pediatrician.
mhm,
Sometimes we have to watch for hypertension and monitor the heart and different things like that. So,
mhm,
wanting to still be impactful for women and children, but maybe not necessarily at the biological level, wanting it to be
mhm,
community level. That was really important. And I started out just kind of doing it for family and friends. When I was in
mhm.
college, I had a classmate, a very close friend and roommate that ended up being pregnant, and being able to support her through that journey kind of showed me that it would be a little bit more than work. I would find fulfillment in that. And it turned out to be one of my passions. And I just try to find ways that I could build on it, maybe not disrupt my day-to-day work, but also
Mhm.
to this, like the passion that it is for me.
Wow. Can you explain how your role impacts a mom that has a doula versus the one that does not have a doula?
Yeah, so I have clients approach me at different stages in their pregnancy all the time. For my clients that are coming in very early and they're wanting to add a doula on their team to kind of start,
Mhm,
incorporate and have them connect with their OB, their peds, their full clinical team. I find that they just have more support. There's more open, honest communication, transparency. There's more room for questions. Whereas some of my clients that come, like my last client, she found me and she was due in a week or two. So we didn't get to
oh,
build as much rapport. I didn't really get
mhm,
as much of an understanding of her wants,
mhm,
needs, and desires, how she might respond in an emergency, or if we
mhm,
deviate from her birth plan. A little bit of that connection was missing. We did have some cultural similarities. She was from the same area.
mhm,
And I went to similar schools. So we had other points of connection, but to be able to really understand her clinical needs, her journey with
mhm,
her clinical providers, and what concerns they had that they had expressed to her, those
mhm,
kind of things sometimes can be missing the shorter amount of time we have to get to know.
mhm. What I'm getting the earlier that you put a doula on your team, the best outcome you would have. That's what I'm getting.
Yes, I would say so. I think in these interactions, when you have a doula early on and you're still going to see your OBGYN, because that is required,
Mhm,
you're still seeing your clinical people to follow up. We are
mhm,
able to kind of come back after or even before sometimes and formulate what questions you might have, what concerns you might have. So you're prepared going into those sessions, into those follow-ups. You can have a discussion with your clinical provider. And then when we come back to the table together, we're able to kind
mhm.
of do those things. You can kind of say if any of those things give you additional pause, even if you disagree with some of those things. My job is to find you other options, other resources, and then you're ultimately able to decide what works best for you with all the information laid before you.
I see it. Now I'm gonna throw a scenario. We didn't practice, so I'm gonna throw this at you, Morgan, because you can do it.
Yes.
I am bringing to you a 15-year-old,
Mm,
and she is 4 months pregnant.
okay.
What type of emotional support will you be able to give this young lady?
Yeah, so we have a young lady. I'm assuming she's got mom and dad or some kind of support. We would pull in her community first and foremost, and that's part of my new client questionnaire. We figure out what your support system looks like. We figure out if you have insurance. We figure out what any
Mhm.
tools that you've had thus far. We figure
Mhm.
out if you have a support team because there are certain requirements for clients that want to labor in the hospital. I personally only do
Mhm.
labor in the hospital. At this point in time, I don't have a midwife that I go to for home births to assist me.
Oh, I see.
So to make sure that I have all the clinical support to work in conjunction with what I do, I like to make sure that we have those kind of things set up. And you can start building rapport with myself as well as your clinical team if you don't have that. Another one of my requirements is I do a birthing class. I have all of my families and any support that will be very, very closely involved or very close to the families participate in that birth class just because it
Mhm.
helps to know different types of scenarios that could happen. Anything that could make this young lady specifically high risk would probably come up, and we could ask some questions to see what
Mhm.
concerns could be from a clinical perspective, what are her own personal concerns. I'm able to kind of understand the dynamic she does have with her support and
Mhm.
any ways that maybe I can help her be more understood, have more confidence in herself as a new young parent. Anything I can do to make her feel supported and feel like she's going into it as prepared as she can be.
Nice, nice. What are some of the myths and misunderstanding that doulas have? They're out in the community.
Yes, well, we kind of touched on one of them. The biggest one is that we can do a home birth, and that's like our primary focus, and you just need a doula to get that done. I have to
Mhm.
say it again a million times over. Doulas are not clinical support. So we will need a midwife or a nurse there, even if you do want to do a home birth just to make sure that you're safe. But I found that another one that's come up a lot here recently with a lot
Mhm.
more leaning towards doing natural births. I found that a lot of people think that doulas only do natural births. So if we have a client that is wanting to discuss more pain management options, whether
Mhm.
epidural or they want to get induced and use more chemical interventions, those things are totally okay too. Our job is to support you, whatever decision you make for yourself, not make that decision for you or shame you for making one decision over the other. So we work with you and we build that birth plan to get an idea of what you want so we can prioritize that moving forward, not shift you away from whatever your thoughts may be that you have for yourself.
You have it all together, Morgan, all together.
I
That's
do.
right. That's good. Sometimes you may have some high risk births. How
Mhm.
would you treat them any different?
So my high risk bursts, I have a lot of requirements, I know, but it's really just to make sure that you're
You
safe
need
and
that though.
yeah, make sure every part of your team is fully informed. We have the best birth outcomes and health outcomes in general when there's open communication between
Mhm.
and care team. So in the event of anything high risk, I would always say we have to loop in your clinical support. We have to do whatever monitoring they recommend to make sure we keep an eye on whatever their concern is. I'll do my
Mhm.
research back end if it's something like preeclampsia, dietary, things that encourage like movement or more
Mhm.
things like that. Um, I like to refer to the research and then I like to dial in my community. So that'll be my clinical
Mhm.
support. I'll always have a conversation with them to see what they feel should be prioritized. And then I'll take that back to the client and be completely
Mhm.
honest with them and give them the space to have concerns, to be upset. If they have questions, we can sit and do the research together. But I find that a lot of the birth classes that I recommend do cover a lot of those adverse health experience that are possibilities in pregnancy. And it can kind of provide some solutions before we get to anything that's of concern. So my families have an idea of what the solution would be in real time, and that can kind of ease their stress a little bit and maybe give them a little bit more sense of actionability and that it can be addressed, even if there's something that's adverse or against what we wrote out all perfect in the birth plan.
You had a mom that her birth didn't come out so well. The baby either, got into distress or it either went to the NICU. So
And
how will you address that?
oh my goodness. In the last birth that I did, we were there for, I believe, 36 hours. She came to the hospital thinking one thing, that she had a scheduled appointment with her OBGYN, but when we got there, we realized that they had actually scheduled an induction. So this was my client who I also kind of contracted, I guess, only 2 weeks before she actually ended up going into the labor. So I didn't get to build that community with her clinical care team, and I feel like that
Hmm.
brought about a few gaps in communication there. But with her not planning for the induction and not really knowing what that meant for her, kind of chemically pushing her into labor, even though her body hadn't given her all the signs that we look for as an
Hmm.
indicator of active labor. Um, as time went on, she grew to be in more and more distress. I was positioning her to try to help the baby slide down because he wasn't moving down into the birth canal. Um,
Hmm.
in a time frame that would work, given that she had taken those induction medications. Um,
Hmm.
we were trying to beat the clock at this point, and because he was a larger baby and she had a smaller frame, we had some concerns while we were monitoring the heart rate of both of them, that the umbilical cord was wrapping around his throat
Oh
while he was
dear.
down. Yes. So
Oh dear.
in that situation, we had done all of the things that I could do from the doula perspective, but at that point, we did need to turn towards other interventions that were not a
Mhm.
part of the plan originally. She originally wanted to do a natural labor, and the way things transpired, we just had to move away from that for the safety of her child and herself. Um, but we had kind of had some time to discuss some possibilities. Because I was able to be there throughout the entire labor, we were able to kind of do some education in the moment as things changed. And
Hmm.
she ended up having to have a cesarean just because we weren't able to bring that heart rate down. And we had major concerns
Oh,
that it wasn't the way
sure.
for him and
Hmm.
get that cord out from around his throat. So it was a very high pressure situation, and it can be quite traumatic for some. So my priority was making her as comfortable as possible, making sure that if there was something that became a new part of the scenario that wasn't discussed prior, I gave her as much education
Hmm.
on as I could. I would tell her, any background information that was needed for things that the nurses or doctors will come in and tell
Hmm.
her really quick, but not elaborate on. So the best thing that you can do is just try to be present, be a support, read your client, see what their needs
Hmm.
are, and try to see what you can anticipate. The things that you control, try to prioritize their needs. But in the event that there are some things that become out of your control, just being present and trying to support your
Being
client
supportive.
is really the priority in those moments.
Mor- Morgan, we have so much going on in the healthcare field.
We
We
do.
do. I
Do.
mean, we go back to school, we learn this technique, there's some more things come in, but we have a different situation here now. How
Yes.
do you help your moms address health disparities?
Yeah, so that is one of those things that is a part of, or I have questions that are a part of my new client intake form that we can kind of discuss. We ask in a tone that's respectful and curious,
Hmm.
just wanting to get an idea of what your home life looks like, what support looks
Hmm.
like, whether that be, community-wise or financially,
Hmm.
just to address those kinds of needs. We do or I do have some experience with, substance abuse disorders, comorbidities. So there are a few
Hmm.
different things that if we are able to have a conversation closer to the beginning and we can kind
Hmm.
of our rapport and start intervening at that point, we can provide a little bit of support to address those disparities. But that is one of those things that we need a little bit more time to be able to resolve. It's harder to kind of address disparities in that way just because they're so ingrained into our lives and so long standing for most
Mhm.
people. Um,
Mhm.
Got to give yourself time to figure out solutions and figure out what resources are available to you and how they can be beneficial. So, just giving yourself time and being honest and transparent. This is, of course, a no judgment zone. Whatever needs you have are valid, and we'll see what we can do to address them. And we kind of start from there.
What would be your technique to um, to help the mom to avoid the mistrust in the doula?
Oh, that's hard. I know with doulas, we spend a lot more personal time, like we meet at the home, we get to know your
Mhm.
family, and we have more personable interactions. I know even with myself, I've had my own experiences in the medical field with, misdiagnosis, mistreatment.
Mhm.
I've had physicians not believe me when I'm in pain or
Mhm.
not believe me when I present a certain issue and go fishing for something else. So that
Mhm.
is one of those things that we try not to give too much energy to. We try to support through, but I think it would be a disservice to not acknowledge it as a very real problem that exists in the medical field right now. We do
Mhm.
have to be educated because we need to be able to advocate for ourselves or have someone that can advocate for us in distress because there are many cases where we're not believed or we're not taken as the primary source for our own care, our own experience.
Mhm.
So the doula can kind of assist in that way because we do have quite a bit of clinical knowledge. Like myself and many other doulas, we have
Mhm.
type of clinical experience or medical experience, even though we're not clinical licensed providers.
Mhm.
So having that perspective and being able to kind of bridge the gap, recognize
Mhm.
when a client maybe isn't quite as clear as the physician is making them out to be and creating room
Mhm.
for a little bit pause and more discussion. Or,
Mhm.
we have our own sessions where questions are asked. So maybe presenting some of those questions so the client
Mhm.
have to ask, but they are presented so they are known to be a concern. Just little things like that, standing in the gap is what really helps to make sure there's trust among all parties, honestly.
Yeah, because when you don't have the trust,
What can we
there you
do?
are. I know. What can you do? You don't trust one another, or the mom don't trust you. We all in bad shape. That's the nurse. We are.
Yes.
We are in bad shape. How can you tell when a mom is going into postpartum depression?
Oh my goodness.
What
Well,
would be the signs?
I think I lean a lot on the community that these moms have, for one, to be able
Mhm.
to notice when they kind of seem not the full 100% version of themselves. Things change immediately for most people as soon as they have a new baby. They have to create new routines and, they have to figure out life with an additional person and the responsibility of that. But certain things like not finding joy in your hobbies or kind of being a shell of yourself personality wise. For moms, I've seen some who don't, um, well, maybe not don't, but have an indifference, I would say, towards their
Mhm.
newborn. And sometimes, not every mom is like, oh my goodness, my child is God's gift to the world. I want to show him to everyone. I want everyone to
Yeah.
come see and appreciate.
Mhm.
Some moms aren't that at first, and that's okay.
Mhm.
Sometimes it grows
They're
and
overwhelmed, I think.
it's quite a lot to handle. So
Mhm.
I always tell moms it's okay to feel overwhelmed more than overjoyed at your new bundle that you've been blessed with. So that's not an oddity to feel that way.
Mhm.
But I
Mhm.
think when it's for extended periods of time or repeatedly asking for help and
Mhm.
finding in the community that people are present, but there's no resolution for our moms, like they're not seeming to recover from that experience. Those are the kind of things that I ask their partners, family members that have spent a lot of time with them, and then me myself, being able to be with them through their pregnancy and through labor. And if I notice a shift, even myself, that's one of those things that I'll kind of ask a few more questions about and see.
So something's happening.
Yeah, yeah. See,
Mhm.
see, it's room for to be inquisitive there to see if it's just, I'm overwhelmed and this is my first time and I'm trying to figure it out, or if there's
Mhm.
something deeper, because sometimes it can be a lack of confidence, sometimes it can be anxiety kind of manifesting, or other mental things going on. Just the depression can take over multiple facets of life. So just keeping an eye on them, that's part of like building rapport and getting a real understanding of the things that bring them joy and the things that really do stress them out. So we can kind of stand in the way where we can postpartum. And then if we can't, then we'll at least notice when things start to shift in a negative way for moms.
That is a lot, Morgan.
It
I want to
is.
ask you, I want to ask you how long do they stay in the hospital now after a delivery?
It depends. Usually for cesareans, it can be 2 to 3 days. Natural births, I haven't really seen them go home the same day the way I used to. Normally, it's like an overnight stay just to make sure you stabilize.
Mhm.
Um, so I would say normally like 1 to 3 or 4 days.
Oh, okay. And how do you find jobs as a doula?
So there's a couple ways that you can do it. I leave my business card everywhere. Anywhere
Oh,
you can
okay.
think. I go to the OBGYN offices around town and I ask them, can I just set a couple of these up here with y'all? And you just
Mhm.
sit them out and pass them out to whoever you feel like would fit.
Oh, I see.
In
Uh-huh.
my apartment building, it's a very young community, a lot of couples and newlyweds. So I leave some at my front desk at my apartments.
Really?
Yes. So it's really just being able to market yourself. There's also a website, doulamatch.com. That's fantastic. You put your availability
Oh.
there. You say if you're a labor or birth doula or a postpartum doula, you can put your time
Mhm.
there. It's fantastic. And then they do reduced yearly fees to be a part of that service. So it's normally $40, but they do half price for Black doulas, Indigenous doulas, and Hispanic doulas, just to try to address some of the disparities. So
Mhm.
in the doula world, we try to at least be very cognizant of those things, the disparities that women of color face, and try to address them. So,
Mhm.
at those sites and match sites where people can search you by whether you're Indigenous, Black, so you can get a doula that's a part of your community if that's helpful in providing some culturally competent care. And it's really nice. People can refer, leave reviews, things like that. So that's usually my
Mhm.
first kind of referral that I give to anyone interested in taking
Mhm.
clients to doula.
Nice, nice. Very nice. This has been such an interesting interview.
Yeah,
Listen, I have learned a lot.
don't tell me it's over already, please.
Well, I really learned a lot. Like I said, I worked, in perm testing. I said, oh, wow. But it's been some years, though, Morgan. It's been some years.
That's all right. I
But,
know it's still sharp.
but tell, what do you want to leave these ladies that are planning to have a baby or if they are pregnant? And I think I want to go with some high risk pregnancies like PIH and things, but we don't have time for that. But what advice would you give them, those that are pregnant or getting ready to deliver or just delivered? What advice would you want to leave with them today?
Yeah, I would say that community is so, so, so important beyond just building your team. Being able to see the resources that you have and for the community that you have to show up for you is so, 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 so
Mhm.
amazing. And it's undervalued, I think. I think people don't realize how vulnerable a state moms are in through pregnancy and into postpartum, how much support would be appreciated, even if it's not anything physical, but just being present. And then having these people that can advocate for you, that know you so well, in the event that anything adverse, anything unexpected happens, they can jump in for you. I just encourage moms to reach out, don't be afraid. Our care team, or the care team that you build, works for you. We are here to support you. We are here to prioritize what you want for yourself. And there's never any shame in that. Whatever you want for yourself, we'll try our best to make it happen, because we are the community. And as members of your community, we are charged with making sure you are healthy, you are happy, and you feel supported through that. So even pregnancy and thereafter, we just want to make sure, and I just want to make sure that you guys know you are so appreciated. You do the hard work. Creating life is no small thing, or else everybody could do it. So I just have to give you guys a few snaps, a pat on the back,
Mhm.
and your flowers for being wonderful, for being amazing, for being magical. And I hope that you spread that. I hope that you spread that. And I hope that you believe it, because you absolutely are. And we'll do everything in our power to make sure you know that.
Very, very good. So those of you out there that are getting ready to have a baby or thinking about having a baby or just having a baby, okay, you know who to look up.
Yes,
Morgan Mason. Okay,
yes.
give us your contact information, Morgan.
Yes, so I am the More to Life doula on Instagram. My website, all of that is more to life doula.com. And I'll see you guys there. I have open availability for 2026. So I hope to bring in this new life with you.
Sounds like fun. This is 2026, isn't it, huh?
It is. I had to
This
pause for a
is.
second to make sure I got it right. I'm still a little bit 2025, but
I know, but well, we're looking for big things in 2026, Morgan.
yes, 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 we are.
Big things, big things. All right, everybody. This is Mary from Straight Talk About Health and Wellness with Morgan Mason. All right. So until I see you again, all right, be safe, be healthy, and be blessed.